So once again, good evening. I'm Dr. Abimbola Onifade. I'm the host of this meeting, Diabetes and Hypertension Intervention Program. This is for anybody that has challenge with this issue, especially those who are from the group. We've been on this program for some days, and the main purpose of this Zoom meeting is a kind of question and answer. It's like a call. It's like a consultation call, because many people have different questions that cannot just be answered straightforward on the group. So I'll see to the best of my ability, if you have questions, how to answer the questions here. Then this meeting is going to be today, tomorrow, next tomorrow, hopefully. The modalities will be communicated on the group. So I want to focus on question and answer today, and we'll take it up from there, then to also talk about dietary aspect if time permits. But we have a dedicated day, most likely tomorrow, for that. So uh, I will open the floor so that we can go straight to the point. And if you have question, please, if you're not asking a question, please kindly mute your mic. So if you have a question, then the floor is open now. You can unmute and ask. And I hope every other person will benefit from it too. All right, so the floor is open, please.
Good evening, Doctor. I am happy to hear from you, and I'm a participant here. So please, I would want to know the foods that diabetes eat that is good for them, especially swallow and things like that.
Okay, so like I said, we'll deal with that in details tomorrow. So the food that are good for diabetes are food that we call something complex carbohydrate. You know, we have classes of food. The problem in diabetes is that the cells of the body are not taking in sugar as they ought to take it, and that is the function of insulin. So that sugar will back up in the blood, and that's why you have a high blood sugar. So there are some food that when you hit them, they will rapidly be broken down. Because every food eventually, every carbohydrate food eventually breaks down and becomes into glucose, turns into glucose. So there are some that are rapidly broken down, there are some that are not. The ones that are rapidly broken down, okay, the ones that are not are called complex carbohydrates. So sometimes you usually say they are rich in fibers. So I usually hear people when they have diabetes or hypertension, they will say, especially diabetes, they will say that they don't want to eat anything that has sugar again. But there isn't really any stuff like that. Every food that you eat, and again, they will say they don't want to eat carbohydrate again. And by that, they are saying they'll be eating fruit. So even food too eventually gets broken down into glucose. Then, or you say you don't want to take carbohydrate again, we're eating vegetables. And vegetable is even a carbohydrate by definition, but it's a complex carbohydrate. Fruit also contains fibers. Then there is something we call glycemic index. So that's what determines how rapidly food is broken down or not to spike the blood sugar. So these are the understanding that guides what to eat. Then whatever you want to eat, the quantity also matters, because a food can be, if you overheat, and when I say overheat, I'm not talking about portion. People usually ask, what portion control should I take? I don't know about that. Once you heat moderately and you eat the right kind of food that has enough fibers, you get satisfied and your appetite is under control. So this is just the overview. To name food one by one, well, there are so many foods. So it is this concept that helps and keeps the understanding. So instead of saying this is what you should eat for tonight, especially, I'll tell you what you should take away. And it doesn't have to do with diabetes or hypertension alone, for general health, but especially its impact on these two diseases. Number one, take away anything that is junk. All those things that is made with flour, you want to take them away, to almost not eating them again. And bread is a notorious one. Then wheat bread is not different from the normal flour bread. So because wheat, like I was saying, is not really low in glycemic index as well as such. So you want to avoid flour, then you want to avoid any kind of drink, either fruit drink or soft drink. Because when you're talking about fruit drink, you can imagine how many fruit are mixed together. So that will spike the blood sugar too. You can heat your fruit, not drink it, you know. Then you want to take that out. So timing when you eat, you want to consider that. So diet is something that is major. I'll talk about and be with you tomorrow. And we have a complete dietary program. Yes, I'll be talking about it tomorrow, and I'm going to be giving example of food. Then we have a complete dietary program that would make more meaning, because most of the things I'll be talking about, I'll be talking about the science behind it. I'll be giving examples of it as well. But if you follow that, it will help you. You'll discover that you have a better blood sugar control. But my focus for this program really is not just for people to control their blood sugar better than it used to be. My focus is for them to be able to reverse high blood sugar. And to do that is just beyond what kind of food should I be eating or not. We'll get into that tomorrow and do it. So I hope for this a little overview helps. Thank you. So please try and make it tomorrow. If you made it here today, please try and make it tomorrow as well. Thank you. So can we take the next question before I answer some of the questions that was posted in the group? Yeah, you can go ahead, please. So please
Thank
don't
you,
wait
doctor.
for
I heard
anybody.
you loud and clear.
All
So
right, sir. All right.
I heard you. I'll be waiting.
Okay, so I'll wait for 1 or 2 minutes. If there's no question, I prefer to answer the question of those who are here directly before answering question of those who are not here. Because the benefit of being here is for you to be able to have a first-hand help. So I'll wait for you for 1 or 2 minutes before I go into the questions that was asked on the group.
Hello, doctor.
Yes, I'm with you.
Good evening, sir.
Good evening, ma.
Okay, my name is Vivian. I asked this question that I want to ask here. I dropped the question on the group.
So
You
it's
know,
better you ask it. Just ask
okay,
it now.
okay. The question is this: last year October, I put to bed. That should be October 25th. So after 3 years, so after I came back from hospital, 3 days later, I noticed that my body is not normal as used to be. I have to go back to the hospital and they check my high blood and they check my BP and told me that my BP is high after 3 days of delivery. And they placed me on drug, Adomant.
Okay.
Less than 6 weeks, I noticed it seemed that it's normalized because I went for 6 weeks checkup. They placed me on Adomant 2 morning, 2 afternoon, 2 nights. So later on, because they asked us to be coming, they asked me, and okay, other people have the same issue. But myself, I'm coming every week. So the doctor later reduced it to twice a day, morning and night. Later reduced it again, just only morning. So my 6 weeks, I went and the blood pressure is okay. I stopped taking the drug for some time. Then I noticed again, like less than a week or 2 weeks, the thing started again, which they refer me to a physician. She also placed me on drug. So since that time, I have been on drug, and my baby is 8 months.
Okay. Okay.
Now,
So it's not uncommon. If you look at the group, you discover that some people have the same similar issue when
okay.
you discover that their concern is that their blood pressure became high after they gave birth, and it has been persistent. So uh the child, if you look, there was our article, lecture on day 2 talks about what is causing high blood pressure and other associated factors. We talk about trauma, and I specifically mentioned birth trauma there as well. The stress of giving birth and all that is involved. A lot of changes that's going on in the body. There's a lot of, in all of this, in all system. By system, I mean cardiovascular, endocrine. Cardiovascular talks about system that deals with your heart. Endocrine talks about system that deals with your hormone, musculoskeletal, and all of it are impacted by childbirth. So it's not unusual to see a case like this. So the most important thing also is that we still deal with it the same way we deal with a person that has hypertension, because what you actually have is hypertension. You understand? The only thing is that that birth process seems to be a a factor that, would I say, trigger now or contributes to it. So what you should
That's
just
true.
do is that you just take it as we are dealing with everybody. So what we help somebody like you most is maybe when we get to the part that talks about a premium program. Premium program simply talks about program that you pay for usually after this free program. So that kind of a program will help someone like you. So we've had a lot of people on the program with similar issue because the program has reached a lot of people. But nonetheless, everything will still be saying that is free. If you put it into practice, it's going to remarkably impact you. So the fact that it happens after birth is not anything to worry about. Even at this, it can still be reversed with such that while you are not taking medication, you are able to consistently have a normal blood pressure. Right.
Because this thing that you said now, doctor, can you hear me?
Yeah, I
What
can hear you.
actually, throughout my antenatal and this blood pressure of 18, I don't have the, because when I started antenatal, that should be 3 months. I started the antenatal. No history of hypertension in my family. I don't know about great grandfathers, but my mom, though my dad is late for a long time, no, we don't have that high BP. So throughout the antenatal, there is nothing like that. But I don't know if this thing I'm saying is what really triggered it, because of I engaged when I entered at 9 weeks and 4 days. This advice from like keep on doing this exercise so that during the labor it will help you to the baby easily. So I was climbing step, like running in my house, climbing step, going down. Then Like 10 minutes later, I heard like a water. I thought it's a water that break, like something flow on my leg. So when I watch, it's bleeding. So they have to rush me to, sir?
Yeah, I'm with you.
So I started bleeding. So I was rushed to the hospital. According to them, it's emergency CS. It was not planned at all, less than 1 hour. So they bring my baby out. Everything is perfectly okay. So I don't know if it's the exercise that triggered it, maybe whether it is the shock that when I saw the bleeding. Since that time, I have been trying all my best to put myself together, to forget about
Yeah.
everything that
So
happened.
whatever would have triggered it, we definitely know that it's part of the birth process. The important thing now is that there is a way to solve the problem,
Okay.
and to just follow through is the solution. Yeah, because I understand that many people are concerned. They want to know what caused this, why it's not like this, it's not like that. So, but even if we know what caused it, maybe we can hold that thing by hand. The solution is still the same thing. But
Okay.
it is sure when you get hypertension postpartum after delivery, that process is a major contributing factor because the blood volume goes up during when you are pregnant, and then the way body adjusts to all of the changes for different people are different. You understand? Especially when what's your weight? Are you
Hmm.
big or small in size?
Doctor, to tell you the truth, I really added weight when I was pregnant. Like my normal weight before I got pregnant is 65. So, but
Okay.
before I put to bed, I clocked it should be 96. And I don't know the
Okay.
reason why. I'm not eating much.
Stretch is
My
good.
mom, according to my mom, is her own body stature. According to her, maybe I inherited it from there. 96. Doctor, by now will be like that kind 110. I'm still
Okay.
heavy.
So it's
110.
okay. It's okay. So just make sure you follow this program till we finish. We'll be
Okay.
able to help you solve the problem.
Okay.
Right.
Thank you.
Right. So you can send me a direct message after this meeting, or you can send it right now so that you not forget. So,
Okay.
right. Okay. Thank you. So, can we take another question? I believe that as we are taking those questions, generally, question and answer helps people to learn along. But I don't want us to wait for somebody else question before you ask it, and other people will learn from it as well. And this question and answer, you can see how I deal with the last person that just spoke now. You can, because I won't be able to be speaking with everybody on call. I don't need to mention your name. You just have to mention what is the concern, and we look at how we can assist, at least information that can relieve you before going further. So next person, please.
Good evening, doctor.
Good evening, ma'am.
Thank you, sir.
Yes.
I've been having this. I noticed this sugar level when I was 40 years. I did not
Okay.
notice it on time. So since then, I've been on drug. I've been on. Now the problem is that I feel like heat too much.
Okay.
At
On your
times,
leg, you feel it.
all my body, like in the night, if there is no fan, I will not be able to sleep. Now, at times, my leg will be hurting me in the night, or as if something is, so as if you are running. It's hot. The two of my
How
leg.
old are you now?
44.
What medication are you taking now?
So they used to change medicine for me, but the one recently now, one metformin,
Okay. How many milligram?
1,000, and
Okay.
triviament, 50
Okay. So
on 1,000.
what's your weight? What's your weight?
My weight now is 74.
What about your
But
height?
my height Thanks. I don't
So
know.
are you
I
tall
forgot.
or short or average height?
No, I'm tall. I'm tall. Average,
You are
average.
tall. Your average height. So it's
It's one
okay.
one point
So
1.6.
okay, it's all right. So now
Mm,
the issue here is talking about feeling heat in your body. No,
mm,
sometimes you can't say this is it on call like this. But talking about
mm.
heat, you are feeling heat under your, you normally feel heat under your feet, Abby, and maybe your palm.
My leg. That if I'm doing exercise in the morning, that's when I'll notice that one.
So now the thing is, diabetes is a kind of disease that affects every part of the, it can affect any part of the body, any system of the body.
Okay.
You understand? So
Mm,
when people have symptoms that are not defined like this, what I just
mm,
advise them to do is to follow the program. This program this is the fourth day now. And following the
okay.
program simply means that everything we have been doing from the beginning, participate in it, read all the lectures, watch the videos, Zoom meeting like this, participate. Do you
Okay.
understand? If you are
Okay.
going into, because there are two kind of this program, free and the one that people pay for. If you are going into the one that people pay for, participate in
Mm,
that one as well, even though it's going to cost you some money. You
okay.
understand? What
Mm,
I know is that people who have done like that, most of those symptoms just resolve, and
okay.
gradually their blood sugar, blood pressure comes to normal as well.
Okay.
Because I'm going to talk about this more as we go on. I just want to focus on what can really benefit now, at least even if this is all you are taking. So there is something we also call peripheral, we call it nerve damage. Like if it is in your feet or your arm, we call it peripheral neuropathy. The neuropathy just talked about some damage to the nerve. So, and diabetes usually cause that.
Mm,
Metformin also has a way of causing that. So what you do, send me a message.
okay.
When you are taking metformin, there
Mm,
is something to do. Usually we prescribe vitamin B12 to
okay.
prevent that, but there is a kind of vitamin B12. There are many other things that are involved. Just send me a message. Let me keep track on you so that
Okay.
at the right time we'll be able to reach out to you. So that's
Okay,
what
sir.
I'm going to say. So all of these things, this with the drug you are taking, also this with the diabetes. So I'm going to be talking about how to, because maybe next tomorrow, what I'll be dealing with is how to reverse the diabetes and hypertension. I've been
Okay,
talking
sir.
about it in the lectures too, but I'm going to talk about it on a live program like this. So by then you will know what to do accurately. And the
Okay,
things we'll
sir.
be discussing tomorrow too will be crucial for you to put in practice and all the stuff that we've been talking about up
Okay,
till
sir.
now. So that's it. Thank you.
Okay.
I hope I'm able to help you to some extent.
Yes, yes, sir. But me for now, I I live like I've used a week now without taking the medicine. I'm
So
reducing my
why?
hand from taking the medicine. And each time I do like that, it will go high again.
It must go high now. You can't just stop the medicine by yourself. Now, okay, let me
Okay.
say this. One of the
Mm,
purpose of this program is to help
mm,
people to be able to stop using medicine. But
okay, sir.
even though that's the purpose, we don't just tell you go and stop medicine. We are going
Okay,
to be supervising people as they
okay,
follow some guidelines in this program, which includes dietary guidelines as well. Then
okay, sir.
over time, some people, it takes us 6 months before their medicine can go up completely. Some people might even take a little longer. But the thing that I've noticed with everybody is that by the time you spend some time, maybe many people say within a month, you begin to
Mm,
have to reduce the medication. The thing is that everybody will deal with them accordingly. Do you understand? So don't stop
yes.
the medicine by yourself. Now,
Okay.
to do that now, it's not possible to just be doing that for everybody. So let me put a caveat that this one that I'm talking about is not on this general program like this.
Okay,
Some
sir.
people comes in to be our client because even though we are doing a program like this, we are also a medical establishment. So some people who want our service, yes, we're able to help them with that. But nonetheless, even by tomorrow, even I'll be telling you some of the things you have to do, even without being our client or whatsoever, in dealing with that tomorrow and next tomorrow. So avail yourself for the meeting.
Sir.
Yes.
Thank you very
Welcome.
much. Thank
You're welcome. So we have about 30 minutes more or less than 30 minutes actually. So I'd like to take a few more questions. Want today to specifically be like a consultation where you can ask questions that pertains to you personally and I'll be able to answer. So next person, you can go ahead. I can see somebody wants to say something. Or maybe you are talking and your mic is not, you have not mute your mic. We can't hear you. So any other person?
Good evening, doctor.
Good evening, ma. Please, you can also mention where you are talking from. You don't have to mention your name, but if you like, you can also.
I'm calling from. My name is Comfort. I'm calling from VI.
Okay, all right.
Talking from VI. Please, thank you very much, sir. I really appreciate your effort. God bless you, sir. I want to ask, what food can somebody be taking? Because me, I really want to go off this medication. I do take amlodipine, 10 milligram for the BP. While the sugar, I take what do they call it? I take, let me just mention the drugs at once. I take, hello, sir. Okay, sir. Okay, sir. I take Downhill, 5 milligram.
Okay.
For the sugar. Okay. So that's what I've been taking for like almost like a year or 2 years down, because I learned it is in our family gene.
Right. So have you been reading my lecture?
I've been reading it. I'm following you every day.
Okay. So like I've been asking everybody,
I'm following you every day, sir.
Okay, that's great. What's
I am 65.
Okay, what about your height?
1.6.
Okay, that's okay. So it's possible to, it's not only is possible, maybe if you look at the group, this group that I'm addressing here is the number 86.
I've seen it, 86.
Yes, invariably we've had close to 20,000 people. Of course, I've not spoken to 20,000 people like this. What I just want to bring out is that for the free program, we've had a lot of people. We have a lot of people that will send message back to say thank you, because there was a time that we give many dietary program for free, and people follow it just for 2 weeks and they see remarkable impact. Then some people that join the normal program as well. So I'm saying all of this to say that it's definitely possible. It only depends on your commitment level. You understand? So the diet to take, I mentioned diet briefly tonight. I'm going to be talking basically on diet tomorrow. I might still answer one or two people like I'm doing tonight tomorrow, but diet will be the major thing that I'll be talking about tomorrow. So then the third thing is that even though I'm going to be talking about diet majorly tomorrow, we have program for people who wants to be off medication. So we have a dietary program. Then we have a special program that is even more than dietary program for people who wants to be off medication. I would enlighten us on this maybe on Sunday. So for someone like you, that would be a good one.
Yeah.
So, but let's start from tomorrow. The diet, start from what you've been doing on the platform. What we'll be doing tomorrow. Try and be part of it also. Join the meeting tomorrow.
Definitely, by the grace of God, I will.
We'll probably start by 7 o'clock tomorrow, being a Saturday. Then,
okay. All right.
So that's what we'll do regarding that.
All right.
Then if you ask me any question like you two do now, please send me a message. I like to keep a record of those who are active.
Through this our platform, or
send me a personal message on WhatsApp through my number on WhatsApp.
All
just
right,
send me a personal message. You can just mention your name, that you are so and so person. Right.
All right. I'll definitely. Thank you very much, sir.
You're welcome.
I appreciate it.
So, yes, I'm really enjoying this. I'm really enjoying this. So, I have some questions that people have on the platform that I want to take this opportunity to answer. But I want, if you are here, I want to be able to answer you. So, next person, please.
Hello.
Hello, welcome, ma.
Good evening, doctor.
Good evening, ma.
I'm calling from Warisa.
Oh, that's great. It's good to have you, ma.
Thank you, sir. Thank you for the good works. I've been following you from day one. My aim is that when I was pregnant of my last baby, that's 2018, at the maybe 7-8 months, I went for antenatal. So I was told that my BP is at the edge. It says at the edge, that they now place me on a BP drug, mild one. So that was how I continued until I delivered my baby through CS. Maybe the fear and the trauma of CS, the day of the CS, my BP was very, very high, that doctors were even scared. So after everything, they said gradually that the thing will come down. That's in 2018. So since then, I've been taking drugs and the thing refused to come down. Presently, I was on 10 milligram amlodipine and lisinopril, 10 milligram. As the thing progresses, it was now reduced to 55 milligrams. Yes, and vasopril once a day. So normally, if I take the drugs, the thing will just normalize. I think it will just be low, normalize. As I choose to take the drug every day. But once I stop taking the drug, like one day, the thing will shoot. The thing will shoot. I told doctor, can I stop it? They said I should not stop it. I can take it at interval. Take today or I will not take tomorrow. But yesterday, after the exercise program that you gave, so I said, okay, let me start. So I started the exercise yesterday. I did in the morning. I sweated very well. My heart was really panting. So this evening I took my baby to the clinic and I said, okay, let me check my BP. When I checked BP this evening, it was 145/95. So the nurse was asking me, he said, Madam, what happened? I said, I'm on the drug. He said, but the drug is not working. I said it's working. I don't know if it's exercise, the rigorous exercise that I did that yesterday. That thing just.
So what time did you do the exercise yesterday?
In the morning. I did that morning noon.
I did morning. What time? Okay, you did in the morning. Then yes, what time did you go to the hospital?
The exercise was yesterday.
Yes. When did you go to the hospital?
This evening, around 5.
Okay, no, it's not the exercise is not what has caused it. So that exercise program that I gave,
yes, sir.
We usually don't give it before. Now, okay, let me explain this. We are switching our program because we like to do some program for free. Before, we used to do a part of the dietary program for free. The exercise program is people that come on our premium program that really get the exercise as simple as it is. So, now why am I saying this? I'm saying this to explain that it is not just one day of exercise that will improve the blood pressure. And it is not just the exercise alone. The diet is also important. Then number 2, apart from exercise and diet, there are some things that are peculiar to individuals.
Sir.
Like you can see, I'm asking people, what's your weight? What's your height? What's your this?
Yes,
so,
sir.
So those things come into play as well. But to answer your question specifically, it is not
Okay.
yesterday's exercise that caused the blood pressure to go up. So continue the exercise. It is
Okay, sir.
normal. Let's say what you are telling me now is that after you do the exercise, you check it and it went up. Still, what I will tell you that it's okay. Now, blood pressure doesn't stay at one place ever. That's why
Okay.
you discover that it is in a range. So we
Yes.
usually want to know what is your range. So today it can be 120, tomorrow it can be 124. Do you understand? Another 130. So we
Yes,
want
sir.
to see what has been the range to know how well the person is there. After exercise, I mean immediately after exercise, your heart rate will go up, your blood
Yes.
pressure will go out. That is normal. Go up.
Okay.
Even if the person does not have hypertension, immediately after exercise, if we check your blood pressure, it will go up.
Okay, sir.
So in that case, it is normal. The blood pressure that is a concern for us is blood pressure. Maybe you are not under any stress, you are not under any emotional rigor, and it's getting high. And what actually makes blood pressure to go up? One of the things that makes it up, there's something we call total peripheral resistance. Just think about it as resistance. Now, when you are trying to resist something, you want to push it away, you are going to use more power.
Yes,
So
sir.
if your blood, in your vessel, and the movement of your blood is trying to push for whatever is causing the vessel to be like what the blood have to be pushing against. That's why blood pressure goes up. What we are trying to do in this program is that whatever is making it like that, we want to remove that resistance.
Okay, sir.
And it's not going to be one day. Do you
Okay.
understand?
Yes, sir.
So what's your weight?
70, 72.
What about your height?
I'm not tall, I'm the short type.
Okay.
I don't really know my height.
So just continue following us. Tomorrow, come along. Next tomorrow, come along.
Okay, sir.
Anybody that has diabetes or hypertension, the general advice I will give them is after whatever we are talking about, for free now, we have been talking about things you should be doing. I will talk about more tomorrow. Just make
Okay.
sure you put your best at that. And as well, you can go further with us into the program. You understand?
Yes, sir.
So that's it for now. Let's
Okay,
take it
sir.
like that.
Okay, my own
All
is
right.
just high blood pressure, no
What do
sugar.
you say?
I said my own is
Yes,
just
yes,
it's just the BP.
yes. I understand.
Yes, sir.
So, right.
Thank you, sir.
You're welcome, ma'am. So we are getting towards the end of the program, but so if we are going to have a question, just raise up your hand so that we know that anybody that raises up their hand, you know how to raise up your hand on Zoom. You see that sign. Just raise it up so that I will take all those who are raising their hand. Even if it's time to go, I'll make sure I take everybody before going. So the next person, please. Galaxy S20FE. I guess you're trying to talk, but we are not hearing you.
Doctor, you have already answered my question.
Okay. That's great. So other people, Obasi, Infinix, DB, do you have any question? I want to see to some of the questions on the group. Okay. So let me just go to the group and see some of the questions. Now, for those who are around today, please, I might likely post this discussion on the group, but it's not what I actually usually like to do. The reason is that people just feel like, let's hear the recording. There is difference when you hear it and you are part of the program. And if everybody are saying, let's hear the recording, nobody will really be part. So even in the future, you are hearing this recording, please try and join us live. And but you can always guarantee posting the recording. Yeah, somebody wants to say something. So, okay, let me take this. I'm a 72, I'm a 72-year-old hypertension and high blood sugar since some years. Okay, what the person is saying that he has hypertension and high blood sugars since some years ago, and my blood sugar is not steady, and high blood pressure. Okay, high blood pressure going up and down, blood sugar not steady, and she wants it to be steady. So this is the same thing I've been talking about. So I would have loved to ask this person some personal questions, like to know the weight, to know the height, maybe some other questions since she has high blood pressure and diabetes. What I would just say, once it's to be steady, just follow this program and follow us into the premium program. The premium program is what people pay for, and it's not outrageous. Anybody that spend money can afford it. So that's what I would say for that. That's the only way, because what this person is saying is want you to, okay, steady might mean going on still using medication and it being steady. If that's what the person means, why not tomorrow? Well, what I'll be discussing tomorrow will help to make your blood sugar and blood pressure steady. Might not mean you'll be off medication, but we have a program that is specifically designed to help people to get off medication. So it depends on what you want. So I'm 64 with low sugar and BP always. So this is another issue entirely. There are things that causes low blood sugar. So to deal with this, I want to know, to ask some personal question and to deal with this personally. So this program really deals with high blood sugar, not really low, but since we are a medical facility, why not? We can still deal with whatever medical condition you are suffering from. So I'm 61. I have sugar, high blood sugar, and BP that is stagnant, 160 over 100. All this started 3 years ago after my accident. So if this person read the lecture that I gave as on the day 2, I talked about it. Trauma is one of the trigger for high blood pressure. So that's what you experience. And the BP is stagnant. So you need help of a program like this. What you need to do, unfortunately, this person did not join the meeting. I hope the person will be listening to the recording. What you need to do is everything I've taught, read it, the videos I've made, watch it. Then what I'll be discussing tomorrow, make sure you join us, do it. Then when we put out opportunity for premium program, join it. 160, 100 is dangerous. And besides 160, 100 is what we want to start doing something about. So that even I'm speaking with you personally, what I would just have told you is to send me a message, ask some questions, know if I'm going to be making some recommendations for you, or if what you are presently doing medically. So that's how I can help you for that. But unfortunately, there's limits to what I can say about that just by reading a WhatsApp message. There is limits to what I can say about that. That's the purpose of our Zoom meeting. So I'm 46-year old. Mine is BP and my legs swell up at times. That's if I stop drug for some time. This also is something that is personal. I would have loved to ask some questions to be able to know what's and what. Then my name is Blessing. Okay. Diagnosed with high blood pressure 5 years ago. I am 64 years old, been on amlodipine 10 milligram. Since then, the last 1 year, it has been fluctuating between 140 over 92 as low as 120, 119, 70. I've been worried because it's until we don't need to be worried. Just join everything we are doing and do it. So I would have loved to talk to you personally. Unfortunately, you are not part of the live meeting now. And the reason why I want question and answer on live meeting is that there is limit to what I can just answer on a WhatsApp group. So it's something, this thing is talk I hear, I talk you hear. I ask question, you answer, not just one-way traffic thing. I am 43 years old. My BP due fluctuates. Okay. So we have answered stuff that deals with this. So it's over 15 years that I notice high sugar level. I'm tired of taking medicine. Please, I need types of food that will help me. It's not only type of food that will help you over 15 years, but we actually can work with you to deal with this. So it's just beyond just type of food. It's beyond type of food. We'll talk more about food tomorrow. We'll talk more about how to reverse it next tomorrow. So 50 years old have been BP drop for 12 years due to anxiety, also high insulin production. Okay. What kind of fruit and food can a sugar level patient eat? I've said much about that. So mid-40, I started experiencing this 4 to 5 years now. It fluctuates up and down. Been managing it with some low-carb foods. Don't even know the right one to eat. Please need your help. So we've addressed stuff like this. So for mid-40s, it's time you deal with this matter because diabetes is dangerous. The older you grow with diabetes, the more damage it causes in your body. So like you are concerned and you want to put the stop to it can be reversed and we can work with you to achieve that. So what kind of food? So most of the people, the concern is what kind of food. And yeah, that's okay. Because even if you see our adverts too, I talked about the kind of food as well. But that's to get your attention first. You also know that, like we've talked about exercise, not just the food alone. And some people also have peculiar issues that needs to be attended to. Okay. Developed by 2000 and okay, I've had this person was on is presently with us on WhatsApp group talking about childbirth and still taking drug. Go deal with that. So don't forget to send me a message personally. Okay. What again? So early 50s diagnosed during first pregnancy as pregnancy induced IBP, reverted to almost normal after 3 pregnancy, but started being a concern after I lost my elder sister in 2021. I've been on medication. So like I said, trauma is one of the trigger. What we need to do now is to reverse all of that and the effect of it that the trauma has on you. We actually on our what's it called special program, we deal with patients based on some uh some of our trained coach deals with our patients in that regard. So one-on-one dealing. So some people, it's not just diet. There are so much emotional issues or maybe psychological, many things. So that's how we come in on professional angle beyond just diet. So 31 years, hypertensive, started immediately after she pushed to bed, experiencing this throughout antenatal. Add a lot of story that it will normalize, it has not normalized. So we've talked about. So if you see the trend of people's concern, it has been childbirth, one trauma or the other when it comes to hypertension. And that's what I'm trying to emphasize. So somebody was asking what is type 1 diabetes and type 2. Now, the answer is, I just gave a straight answer, simple answer that type 1 usually start from childhood, type 2 usually from a person would have been an adult. But yes, that is it. In fact, type 1 is so common in childhood that usually called juvenile at a time. But the truth is, type 1 can still happen even in adulthood, but it's not common. And type 2 has already started happening in childhood now. So type 2 is what really deals with food and the rest. Type 1, food doesn't really, food cannot reverse it. What happens in type 1 is that there is no insulin production in the body. So you need to supplement it external insulin. What happens in type 2 is that in type 2, the insulin, the body is not sensitive to insulin. So the cells of the body, insulin is not able to take sugar into the cells, so it backs up in the blood. Now, if you are on this program and you don't know either you have type 1 or type 2, most likely than not, what you have is type 2. Type 1 is only managed by insulin. You can't take any tablet for it. So if you are taking tablet and it's controlling your blood sugar, you don't have type 1 because tablet does not work with type 1. It is only insulin. I mean, when I say only insulin, drug is not useful. So if you are even taking insulin for and you are still taking drug or you have taken drug at a time, that's type 2. So that's a simple way to know. There is a test to do that, but you don't even need it if you can just fix what I just said now, because it's really done. Last one I know that we did, we sent it to Dubai to be able to get a certain parameter. So 70 years ago, diabetic, I want, please, your help. My money has finished in buying drugs. So we'll deal with this. We'll deal with this, but I don't know what level you are. So just continue following us. Money has finished in buying drug. Yeah. So it's cost saving. Be able to reverse diabetes. You don't need to be buying drug every time. So it's a smart decision to take. That hypertension for more than 15 years, diagnosed 2021. So that's still early. So it's still early, and it's time you deal with it fast. Okay. I think even if I have not read any other particular question, everything is covered already. Somebody asked, what stage will the person know that he or she is diabetic? Because some doctors said high sugar is different from diabetes. Please answer me, Matilda. So the thing is, what we deal with in this program are people that have already been diagnosed. It's not really worth it for me to be trying to make diagnosis on a WhatsApp group, on a Zoom meeting. But for general knowledge, yes, there's something we call pre-diabetes, and I talk about it in the lecture too. So the blood sugar might be high. If it does not reach a certain range, and measured on different occasions, like 2 different occasions, so we won't diagnose you of being diabetic. But I don't want to even talk about making diagnosis on this program. I just prefer that people are already diagnosed. They know that this is the problem, and those are the people we are dealing with. We are not trying to make diagnosis if you have the problem or not. If you don't know if you have the problem, then go and get diagnosed. Then this program will be useful for you. But you should just continue following us. It's even good for general health. Okay, so I'll hold it here for the group. I think I've been able to address many of those questions, if not all. The only concern is that some of the people that ask those questions, I would just have loved to ask them 1 or 2 questions personally, but some of them are not here. So, is there any other question before we call it a day and we continue tomorrow? Any other question? Please just feel free to ask the question if you have personal concern for your health, because this is just like a consultation. When I know what your concern is or what the problem is, I'll be able to address your own personally. Other people will learn from it as well. So if you have any concern or question like that, you can please ask. So I'll wait for that for another 1 minute. If there is none, then we'll call it a day. It's just like 2 more or 3 more minutes, and I would have spent 1 hour in this program. Thank you.
Good evening, doctor.
All right. Good evening, ma.
Sir, please, I was the one that asked the diet that a hypertensive patient can take, and if the patient should abstain from salt entirely.
Okay.
I chatted you up.
You can't abstain from salt entirely. So in our premium program, we have a particular course, a particular lecture called hypertension antidote. In fact, when you talk about salt, there are 3 things that your body needs. Your body needs oxygen. Your body needs water. The 3rd thing is your body needs salt. If your body does not have salt, you cannot survive. And it's not like your body is producing salt inside your body. So you need to eat salt. Now, there are some people that in their hypertension, it has been discovered that if they cut salt, it improves dramatically. So that the hypertension is most of what I call salt dependence, so to say, not everybody. Then again, for everybody, you want to keep salt at a normal level. You don't want to overeat salt. Then again, there are some kind of salt that are best because it contains all the essential elements. So this question that you ask are some of the stuff we deal with on the premium level of this program, but I've just mentioned it again now. So talk about salt. You can buy salt that is sea salt. Sea salt,
Okay.
SEHSALT. We have Celtic salt, we have Himalayan salt. So those are better because it contains all the nutrients. The table salt is just sodium chloride, you know.
Okay.
So, but the sea salt contains everything. But other components of the sea salt too is just little. Now let me tell you something about seawater and sea salt and all the rest. The seawater contains most of the electrolytes that's needed in the body, that in such a way that sometimes maybe historically or whatever now, they can take water from the sea and transfuse it into people's body. I've not done that before and I've not seen it done. I'm just talking about just general historical knowledge. So from that, you can know how useful sea salt can be. So you won't have to cut salt completely from your food because your body needs salt. And but everybody, even if you're not hypertensive, salt should not be eaten excessively. Like Yoruba people, we have an adage. They said that you don't eat salt as a sign of wealth. If I translate them, Akifola Jeyo. So you don't say I'm a big man, so I'll start eating plenty salt. You know, that's it. Okay.
Thank
One
you.
last question. Yeah, one last question. Let me take one last question. And do and then any last question? After this, anybody that have question, just contact me personally. Okay. So in the absence of question, does anybody have anything to say? You can mute your mic now and let's know, especially those who have not said anything today, how helpful as this session is. I actually want to know so that I can know how often I will do this. If it's something that is very helpful to people, why not? So I'm waiting for feedback. Unmute your mic and let us know before we call it today now. Okay, it's like nobody is talking. Is that to say that it's...
Doctor, you asked question.
Yeah, I was asking how helpful is this session because I want to call it a day.
Okay. Okay. Thank you so much, doctor. I really appreciate this.
You're welcome.
Appreciate it. Please, I learned one or two things here. I'm happy being here, and I would love to. In fact, I would like to proceed more.
Right.
I would like to learn more. Thank you so much.
Tomorrow we'll do this again. Next tomorrow we do this. So the program is like a 7 days program. We've done like 4 days on WhatsApp group. So this is the Zoom, the live call part of the program. So today, tomorrow, and next tomorrow. In future, we might still have some discussion, general discussion, but for this program, by Sunday, we should wrap it. Oh, Sunday, that Sunday might not be possible. I just remembered now. Wow. Let's see how it goes. So tomorrow, we'll maximize our time tomorrow. I'll be in a meeting from 5 o'clock on Sunday till 9 p.m. Okay. Thank you, everybody.
Thank you, doctor. Thank you. Good night.
Thank you, sir. God bless you.
Welcome.
Thank you, sir. Good night.
Thank you.
Good night, sir. God bless you.
Good night.
Good night. Thank you.